Welcome back to Inside Personal Growth. This is Greg Voisin, the host of Inside Personal Growth. And joining me from Coeur d'Alene, Idaho, is Dr. Jeffrey Larson. And Dr. Larson is going to be speaking with us this morning on how we're actually kind of treating back pain or back pain. He's a specialist in that. And he owns a clinic called the Coeur d'Alene Spine and Brain. And prior to him doing this, he was a renowned neurosurgeon as well. Good morning to you, Dr. Larson. How are you?
Good morning to you. I'm very well. And how are you?
I'm doing great. And it's good to have you on our show. And this is an unusual show for our listeners. So let me kind of frame it up for them by giving them a little bit of information about your background. And then we're going to go into the intro and then the questions for it. But this show is intended to be educational for all of you who are out there, and also educational for any of the physicians that are tuning in that want to learn more about a product called IntelliFat BOD. We'll get into that during the course of the questions here. Dr. Larson is a board-certified neurosurgeon, as I said a second ago, spine surgeon, and founder of the Coeur d'Alene Spine and Brain. He received his undergraduate training at the University of Michigan. After receiving his medical degree from the University of Cincinnati College of Medicine, Dr. Larson completed his surgical internship and neurosurgery residency training at the University of Cincinnati Medical Center and the Mayfield Spine Institute. He devotes his medical practice exclusively to the treatment of disorders of the spine. He's an expert in the areas of minimally invasive, which we're going to be talking about, spine surgery, microscopic surgery, surgical and non-surgical treatments for serious back and spine problems. You can learn more, as I said a minute ago, if you want to go to his website. We are going to have links to that website, so that'll be in the blog, so take a look at it. He is a special guest to the show. He's just not any regular medical practitioner. He comes with a really rich background. And as I said, one of the primary reasons for having Dr. Larson on the show today is because his remarkable work with the Cellmyx and IntelliFat BOD. Through this innovative tool, Dr. Larson has been achieving significant successes, transforming the lives of his patients, and pushing the boundaries of what we understand about the body's ability to heal and rejuvenate itself. Whether you're familiar with this or not, the term regenerative medicine, for all those listeners who don't understand this is at the forefront in today's world. So we'd like to enlighten and inform you, and maybe even inspire you to think differently about your own personal path toward your well-being, how you might treat yourself. Dr. Larson, thanks for coming on the show. Thanks for spending some time with us. Let's start with, really excited to kind of delve into your unique approach to treating patients. Could you elaborate on what sets your practice apart from other neurosurgery and spine surgery fields? Because, there's a lot of choices that the listeners could make. And you're actually at the forefront and bleeding edge on doing this kind of treatment. So they'd probably like to know about that.
Yeah, well, I think you, for your listeners, and welcome everybody, I think what should resonate with you here is what Greg said. You need to think differently. You need to think differently about how you're being treated. There's a healthcare system out there that has an entropy to it. And this results in a destructive chaos, if you will, and it's not good. And I think everybody who's listening to this has probably had some frustration in dealing with the system, and that's in every specialty. In neurosurgery and spine in particular, it's more sensitive because of the disease that we're dealing with, the problem, the life-changing thing that we're dealing with. So I think for starters, it's important for you to become sort of the CEO of your health. You need to educate yourself. You need to become familiar yourself with what is available to you and seek that treatment. What differentiates me from my peers, quite honestly, is that I take more responsibility in the outcome, in my opinion. I have, and when I when I graduated from my residency program, I went to work for a hospital system, a neurosurgery group, a large group in a hospital system. I opted out of I was on an academic course. I was well published, did a lot of research. I went to medical school to be a biomedical engineer, quickly switched into the sciences, and then I went to college to Michigan to be a biomedical engineer. I was a student athlete there, and in that very, very diverse environment, and with being a athlete and a student in that setting, you take ownership, you take responsibility, and that resonated with me throughout my training. I met my mentor in neurosurgery. Had no intention of being a neurosurgeon. Met my mentor in neurosurgery during medical school. Switched into neurosurgery and was destined for academics, but opted for more of a different lifestyle.
Well, you've also been an inventor too. You've invented products for this, right? That you've patented and put out there.
Yes,
and that's a difference, because not all surgeons also have created products. As an offshoot, what, without getting into too much detail, compelled you to want to go invent these products to help further what I would say the effects associated with somebody going through spine surgery to a positive standpoint?
I've just always gravitated towards trying to solve problems.
Yeah.
And so in these the way you used to patent would be you'd draw art, and that art would be signed each day, and you'd have these pictures and drawings, and it would be set, the time set, it would count as prior art. Now you have to actually go through the mechanics of actually filing patents and such. But in that realm, I do have numerous patents out there, and I have products that are in the market right now and being used in patients in spine surgery as we speak, to try and better outcomes. And it's just it was sort of the inventive biomedical engineer in me that got matched with this now neurosurgeon.
Yeah, it's fascinating. I was looking at some of your research papers and things that you've done, and obviously you are very knowledgeable about this area. But for many of the listeners, they might be unfamiliar with neurosurgery or spine surgery. They may have been advocated to have that, but maybe haven't gone down the road. Could you describe what that entails and how you differ from other surgeons' way of maybe approaching this? I would assume that you're looking for more minimally invasive solutions before you're ready to just go ahead and cut and do what you would normally do, right?
Absolutely. Not only does when you're in medical school, somewhere in your clinical years, you decide whether you're going to be a medical doctor or whether you're going to be a surgeon. If you're going to be a surgeon, what kind of surgeon are you? You can be one that saves lives, or are you going to be one that makes people prettier? Not only does neurosurgery involve the life of a patient, but the discipline focuses on the diagnosis and the treatment of the brain, the spine, and the peripheral nerves. It focuses on an entire system, not just a part of it. And the diagnosis is key to the success of an outcome. I pride myself in the diagnosis. We spend so much time with the patient in terms of figuring out, by way of their evaluation, their history, their physical examination, and the imaging and other sensitive tests available, as to what's wrong first, and then be open to the variety of treatments.
Well, it's advanced. I watched a video at your website, Dr. Larson, about you doing a surgery on a gentleman where you're using a couple of cannulas that you inserted, and then you had a device you were looking at on a screen to see exactly where to insert what you're doing. But it was certainly a very minimally invasive type procedure. It wasn't like, well, I'm going to go just take this knife and cut this guy's back and whatever. And I was really taken by that, because the advancements for our normal listeners, not maybe the physicians, have been so monumental in how you're treating patients. What are some of those things that you're now using to treat these patients that have really minimized and made it more a minimally invasive a surgery?
It's a lot of it is in the approach. Okay, the less destructive approach. I think the cannulas you're speaking of, those were developed one morning starting back in the early 2000s. I was drinking coffee in the morning, and I was making coffee, and I had one of those gold Mr. Coffee filters that you put in and you pour the coffee into. And I'm looking down that and I'm thinking, in another version of this, I could treat the spine. And on came this retractor system that allows the surgeon to get into the spine through the muscles, splitting the fibers instead of peeling them off the bones, being able to do all the reconstructive work you need to do. And so the less destructive, the reason though for a less destructive approach is to have less complication, less blood loss, quicker recovery. You take that mentality and give it to a scientist, an inventor, a creative neurosurgeon. Well, that's where Cellmyx comes in. This is where now I'm handed another tool, regenerative medicine, these potent little regenerative cells that can help that patient recover even faster, even more effectively.
Well, how is Cellmyx helping you in your clinical practice there? In other words, you've got the Cellmyx IntelliFat BOD kit. It has cannulas in it. It's got everything in it in the kit that they need. Could you describe kind of the product, what kind of procedures you're using in regenerative and this pain management area with the Cellmyx?
Maybe for the viewers, let's talk about what these cells we're speaking of are. Everybody's probably heard of stem cells, and that's sort of a phrase that's been applied to almost anything that can be, unfortunately, anything that can be injected. And that's where we get into confusion, and that's where it's a buyer beware environment here. Okay. In this country, use of cells in human tissues are regulated by the FDA. And there are strict rules about this. They need to be autologous. They need to be from you. They need to be taken from you and minimally manipulated. They can't be enhanced. They have to remain in the form they were. They have to be with minimal manipulation, be converted to something that can be delivered back to you. And that needs to be delivered homologously in like form and also on the same day. So these cells can come from bone marrow. They can come from fat. They can come from blood. As it turns out, as you age, one thing gets better: your fat. And the creative minds at Cellmyx have put together a package that allows surgeons, clinicians like myself to follow all those FDA rules and harvest from the patient in a minimally invasive way these adipose cells, these adipose tissue, this fat, which isn't only fat, it's all these other things that are in this cocktail of biology, which include pericytes and exosomes and proteins, all of these things that are kind of like the mother's milk instead of the baby formula in enhancing your biologic response in your body to let it heal. So what I've done now is let's take a discectomy. A guy comes in, and here's a success story for this technique. Guy comes in with a herniated disc. The cartilage that cushions the spine herniated, and it's compressing the nerve. And he's absolutely put out by this. And many of you have had this problem and know what I'm talking about. Mm-hmm. So in that case, we try to treat that non-operatively. We work with physical therapists, with chiropractors, with massage therapists, but just exercise and rest and some medications and such. But you want to get back to production without question. We want a performance-based result. So when that doesn't work and surgery is in the forefront, you want to do it in a minimally invasive way. So Greg, you've spoken of these little cannulas. Now, instead of making a big opening, it's all outpatient. It's through a small little tube, still with the microscope, with the usual neurosurgical, microsurgical tools, and remove that little fragment of disc that's compressing the nerve. But rather than just leave in that setting, what I'm doing now is I'm taking this potent biologic injection that contains all these cells, and I'm injecting it into the disc space at the time of surgery. It was just, I can tell you the success rate has been high, and what's even better is the failure rate is zero. There's no complication, there's no risk to this because it's your stuff. It's your cells.
So let me get it right for the listeners, just so they understand. you're doing the surgery minimally invasively, then you're using the Cellmyx IntelliFat BOD kit, and you're injecting those cells back in there so that there's a quicker healing. Do I have that right?
Yeah, listen to this. So imagine this. I get a text a couple weeks ago. I have a pretty, if when I take on a patient, that patient has decided to take responsibility for themselves and they are part of the program. And I go to bat for them. And it's not off. I mean, they often have my cell phone number. They might have it because they won't abuse it. They know not to, but we stay in touch. We stay on things. This, a gentleman texted me, and here was a text: "Doc, I can't thank you enough. We came in second place in the shootout." Now, what that means, this was 6 weeks and 1 day after a surgery in the back where I took out a herniated disc and backfilled that disc with the biologic injection. And so what that means is he played 4 rounds of golf, did well enough to make it to the shootout. This was he played a lot of golf before this, right?
Yeah.
Then so at the 6-week mark, he's playing in a tournament, 4 rounds, a shootout, and comes in second place. My response was, thanks for being so compliant. But this is a new era. This is quicker recovery. And what happens is this autologous potent product that Cellmyx creates, helps me create, is yours. It's just put back and redelivered into an area that needs it, and your own body goes on to heal this. And I've got cases too where I don't do surgery, that instead of a herniation that's causing an acute spine crisis, we're able to manage that crisis without surgery, but still treat the disc with the concoction and have a successful outcome.
Question for you. A lot of your patients, I'm sure, and some of our listeners out there obviously have various forms of insurance. When you go in for the back surgery and it's been deemed that it's necessary, that's one thing. What's the situation with relation to the additional injection? Because some people out there might be asking right now, it's like, okay, I have, I know Dr. Larson's going to do this and it'll be covered by Medicare, or it's going to be covered by my insurance. Do you find the insurance carriers looking at it as a full treatment or saying, no, it's divided up, we're not going to pay for that segment?
Greg, this is our dilemma, unfortunate dilemma. Traditional healthcare is not designed to optimize outcomes.
Right.
Designed to limit financial risk. So I don't generally, when I see a patient, I contract with the patient. I mean, It's not a written contract. I don't worry about the contract with the insurance companies anymore.
Okay.
Because we'll get nowhere with that. It's the decline, it's the chaotic decline of what's happening. And to be a part of that system is, quite frankly, it's not in my interest. Insurance companies, some work comp, like injured worker programs, they a lot of these, as difficult as they can be to work with, they want these patients back to performing. So they may authorize this.
Yeah, I
Medicare.
do see it starting to go down that road, Jeff. In other words, look, if you were to look at a spine surgery, the cost associated with full-on spine surgery versus using something like IntelliFat would be quite a bit less, right? And especially if it got rid of the problem, and you're saying you're using this successfully, and I love the success story. It's always great to tell stories about clients who are out playing golf 6 weeks later, especially after a surgery. What are some of the specific cases or conditions that you found that the IntelliFat BOD kit where it can be particularly effective? And I know you've been having, and I always hate to throw up percentages, but it's about an 80% success rate with this, right? Somewhere in that range?
Right. Somewhere 70 to 90% success rate, I'd say. Some cases are more effective than others. If somebody comes in with a degenerative disc in their back, a deteriorated disc, in the current situation of how I'm treating these, I don't want the patient to throw unnecessary dollars at something that doesn't have a high likelihood of working. Okay. Surgery is not always the case, but sometimes surgery is the case. So there's sometimes where I opt for putting in an artificial disc or doing a minimally invasive fusion or something to restore that disc if it's so far gone. Okay. It used to be, I've been using stem cells from bone marrow since 2000. I mean, when shortly after I got out of my residency. The problem is, as you age, your bone marrow quality goes down. With the identification that these adipose-based cells can act phenotypically and immunologically just like stem cells. Well, as you age, there's one thing that comes with you, unfortunately, and that's fat. And so what's great about the Cellmyx product, the kit, and one of the things that differentiates it from some of the others I've used is I think the detail that goes into both ends of it. There's a harvesting part of it,
right?
And there's a preparation and delivery part of it. Now, let me tell you, I'm pretty strict and critical about what I use. And I remember the day I did a surprise visit to Cellmyx. They'd never heard of me. They didn't know I was watching them, but I was interested and I was in the area. So I sent the CEO an email saying, "What are you doing this morning? I'd like to join you for coffee and see what you're selling."
I heard about that. Yeah.
And he said, and I went and I watched, and quite frankly, they walked the walk. There's a process to this. There's a process to preparing, to taking your cells and tissue and converting it safely into something that is effective. And one of the things about the Cellmyx product that is easy to use. The kit is self-contained. It's very easy to use. The detail that goes into the cannulas from which we do the liposuction.
Yes.
Don't let liposuction scare you away. It's an outpatient procedure done in my office. It's very soft. It's not a bothersome deal. You put your headphones in and listen to a podcast, and 30 minutes later, I've got this solution that
You've harvested a lot of cells. Yeah.
A lot of cells. And quite frankly, as far as I know, it's the largest, most abundant amount of cells created by one of these FDA-approved minimal disruption kits.
Yes, it is that we know of. That we know.
I use it now. Now I'm a neurosurgeon. This type of cellular medicine works virtually in any part of the body. Shoulders is fabulous. Absolutely fabulous for shoulders, knees, hips. Often, when I'm doing this, patients, sometimes you get more than you might need for the treatment that the patient's there for. So it's many occasions I may do the knee or the back and the knee.
Because you've harvested. About how much do you harvest when you are harvesting it?
You can decide
what in the way of cc's.
Yeah, I'd say for a low back, I usually have 4 to 6 cc's in the disc base and 1 cc in each of the facet joints. So I'll get about 8 cc's. For the knee, it's somewhere around 6 cc's. Shoulder, usually something like 8 cc's. Some of the cosmetic procedures, which require more or less, you can use this for it's very popular for cosmetic procedures.
Well, it's interesting, and I think the listeners who are in the general public need to realize this. They're harvesting it. What he just said, you put your headphones on, harvest the fat, and basically then he's filtering it, and then he's putting it in a syringe, and then he's injecting it into these areas. And I think that's the minimally invasive part of this whole thing, which makes it so, I want to call it less painful than anything else could be. Now, there is this increasing interest in regenerative medicine and its potential in various medical fields, as you know. We're seeing more and more and more of it. How do you see the future of neurosurgery and spine surgery evolving, especially with these tools like Cellmyx's IntelliFat BOD kit? What's on the future for you as you kind of move your practice into the future and you look to see what's coming? And in your case, like you said, you're making the arrangement with the patient direct, regardless of what the insurance companies are doing. Not everybody can afford it, right? And so that is part of the issue. But for those that can you tell us what you're kind of seeing in the future and where we're headed?
Yeah, I tell you, as long as this does not get abused, okay, as long as it's not misrepresented, mismarketed, and doesn't disappear because of or become too confusing for the patients, because it's out, if you're on social media right now, there's so many
Yeah.
options. So you really have to do your homework, do your research, patients, public. You have to really, like I said, be your own CEO. Look after this. Do not, even your doctor isn't going to necessarily, he may be, he's doing what he or she is trained to do, but that is not necessarily what's in your best interest. Okay. So my eyes have been open to regenerative medicine since the late 90s. I've been using mesenchymal stem cells in my spinal fusion cases. Since then, mesenchymal stem cells are these cell lines. When you're talking about adipose derived stem cells or mesenchymal stem cells, you're not getting into any ethical dilemma. These are from the patient. They are from they're autologous, and mesenchymal stem cells generally do great in converting to bone and things like that. The adipose-based cells seem to have more ability to differentiate into the soft tissues, the cartilages, some of the more cushioning things to the aging spine and joints.
Mm-hmm.
Whether it's just repairing what I've done at surgery or preventing surgery, it's been a growing part of my practice without question. And what I'm finding, Greg, is that even though I've prided myself on doing the least invasive surgery possible to get the maximum outcome for patients, now we're in a situation where I have this ability, with proper diagnosis and proper delivery and proper harvesting and preparation of the product, which is where Cellmyx comes in, you can even skirt surgery. So the future is bright. The future is going to be one that is going to be easier for the patient that is going through one of these spine crises or orthopedic crises.
In your estimation, knowing what you know about this, basically harvesting the fat, cleansing, fat transfer, adipose, and back re-injecting in the patient. Once you do that and a patient's reported back to you a successful outcome, how long would you expect that basically to last? In other words, is it indefinite? Do you see it as like a 3-year kind of treatment? Is it something where they may have to come back and get another treatment, but it has prevented them from having major surgery?
Well, I'll tell you, when you do an injection like this, what's going to happen is there's going to be an immediate lidocaine effect. So, for example, you may leave that procedure and feel pretty good because the area has been numbed.
Right.
It takes it takes some time for this to work. There needs to be an inflammatory response that happens. So first you may have a little downtime, 3 days of swollen knee, 3 days of swollen back, where you feel like you've gotten worse. But then it starts to kick in. And what I'm hearing from my patients is usually at about the 3-week mark, they've gotten to their baseline. Mm-hmm. And then from there till the 6-week mark, they start to see an increase. And I've been following them as if they're surgical patients. I've been doing the same kind of come in at 6 weeks, come in at 12 weeks, or we can do now often they come from distant places, so we can do telemedicine visits. But because I don't know that you need to, generally you don't repeat the procedure. In your procedure, you might enhance it. You may do something like if let's say they've at 6 months, they've gotten to a little plateau and want to boost, you could do something like PRP into that area to try to stimulate that process to keep going. The cells are in there, they're doing their thing, they can be turned on a little more.
But with your patients, what you've experienced in these success stories is most of them, like the gentleman you related with playing golf after what was it, 6 weeks? Is
Yeah,
what you
yeah.
said?
6 weeks.
Yeah. And won the tournament too as well. Yeah, and I'm sure you've got lots of success stories like that. Do you have any others that might be worth relaying to our listeners so they can, hear what you've
Yeah,
been
sure.
doing with this?
I can tell you that a patient, a woman with a shoulder injury, shoulder out, was going to put off was worried she was going to have shoulder surgery. She heard that I was doing this stem cell work, and she came to my office to talk to me about it. And she was going to put off a trip she had planned with her family to go to Europe, and because the surgery was going to put her out of that. And I examined her and looked at the imaging, and there was nothing dangerous about what was going on. And what a perfect setting to give this a chance. And the postcard from Europe was very nice. It was quite nice. And really, I'll tell you, I'm not an orthopedic surgeon, but as I said, cellular medicine, the same principles can be applied to any joint, and some parts of the spine are like a joint. I've seen patients out of my field for shoulders or knees that have been told by their orthopedic surgeon, call me when you're ready to have the total knee or the total shoulder. And we have reversed that process. So
you've basically gotten patients from other doctors who wouldn't do what you're doing, and they came to you and you did a minimally invasive procedure and helped them out tremendously. Is that what you're saying?
Correct. That's correct.
Yeah.
That's correct.
So for the listeners out there who are considering a procedure or currently facing some type of procedure or neurological issue, what advice or considerations would you have when exploring treatment options? You talked about that you pride yourself in how you approach the diagnosis, right? And I think that is a key here. I mean, you've spent a long time with the patient, or at least the amount of time necessary to get the right diagnosis before doing anything. What should they be considering when doing this? If they're out there in podcast land right now listening to us, and who knows, maybe they're on the other side of the country, the other side of the world right now, because we have listeners from everywhere. What would you advise them?
You need to what you want to optimize your health. So take a look at yourself first and make sure that you're in the best condition you can be to do this. And I tell my friends, my family, my mom, the same thing. When you go to the doctor's office, try to be as educated as you can, because that's your time to ask questions. That's where you can, if the doctor doesn't have time to listen to you or is just set on their ways, that's probably not the best situation for you, unless you need that procedure and that surgeon, that doctor is, the so-called best at that procedure in your area. But first get an accurate diagnosis and be confident that you have that. Mm-hmm. You can test that. You can and I don't know how to coach you on you just have to feel that you have the proper diagnosis. And of course, you're going to have to trust that that's the case. So you're going to have to really.
Well, it sounds like the people that came to you came under a second opinion. Meaning, the first doctor said, "Hey, come back when you're ready to get this full knee replaced."
More and more. I still get this. Sometimes I honestly, there's a time where I'll get, Joe Public walks in the office and how you doing? And it turns out that he or she have the ideal case for something like the IntelliFat. And I'll say, what led you here? And it can be something and I love this one. It's like, I was going to see Dr. X, but his waiting list was so far out there that I could just get into you. And I'm like, really? And I'm just thinking in the back, I don't say anything. I just go with it and just lucky guy, lucky you, But more and more, it's second opinion. It's patients the public is getting more aware.
Yeah.
And they're showing up, and more, it's a patient that has a surgery scheduled for, a few weeks from now, or heard this, or wants to hear that. And I do a lot of surgeries. I'm very, very skilled in this. I'm in a sweet spot in this. I've, as you said, developed some of the techniques. I practice them, and and talk about 10,000 hours to becoming an expert in something. How about 10,000 cases? So something where I'm on the other side of that curve. But I welcome and embrace these competitive technologies, and they work. This one works. Not all of them do. This one does.
Well, look, you mentioned TikTok. We looked at Instagram, Facebook, and you're out there. I mean, you've got your postings at many of these places. And as you said, the general consumer listening today can go around and do a lot of research on Google and find these things. And for the listeners listening today, you're going to go to cdaspine.com. That's where you're going to find more information about Dr. Larson. You obviously can Google him, and when you Google him, you're going to come up with 5 or 6 different pages for him. He certainly is one of the premier physicians doing this kind of work. And if you are looking for a second opinion, I would highly recommend that you call his office. Like he just said, he actually just said this in his interview. He gives out his cell phone to some of his patients. That's really kind of unusual. Now, it's not abusive. I'm not saying he's going to give all of our listeners his cell phone, but
I haven't had to block anybody yet. They know, don't take offense if I block you. It's just that you kind of so-called butt call a little bit.
Exactly. But so look, we know that the IntelliFat is working for you. We know you're working with other procedures as well. How would you want to leave this for both the physicians that might be listening today and or the general public today who is considering a second opinion or even a first opinion, as far as that goes, on a back or neck or spine surgery that they think they might need as a result of chronic pain, which has been going on for years. And they've had that MRI, and I'm going to tee this up, that says, hey, Dr. Larson, the MRI says, between vertebra 5 and 6, here's the degenerative disc. What would you tell them? How would you sum all that up?
Okay, let me go through that in the list here for the physicians out there. Okay, don't this is not investigational necessarily. What we're doing here is we're trying to harness your patient's cells, formula, regenerative cocktail, if you will, and applying it back to that same patient to give them a chance to heal what is broken. It doesn't, what we're doing, what you're doing as a surgeon, what I'm doing as a surgeon isn't always working, and it is not for everybody. Okay. There's also those cases where you need surgery. And what I'd like to share with you is that this enhances the recovery. For the patient out there, I want you to be careful. I really buyer beware, because there are rules to this. If you're going to an office and you're being given something that's been pulled out of a drawer or a refrigerator or isn't yours, wasn't taken from you, processed the same day and delivered back to you in the same day, if the FDA had enough manpower, that place would be closed down. Inside the US, that is not allowed. And I'm not saying that what's being delivered is a bad product. It's just that we have to follow the rules of administration in this, because they are laws, they're rules, and human cells and tissues. So let's stick to what we're allowed to do and stay in our lane on that. Don't be afraid of having surgery if you really, really need it, because it can change your life. It can be the most positive thing you've ever done. And certainly if you can avoid it and live full. I don't want you to live 50% and be fighting, that's not what we're trying to get you.
You don't want to be disabled as a result of it.
You do not want to be disabled. You don't want to be, you want to be well now to enjoy where you are in life. Be present, be where your feet are.
Well, you have literally in the last 45 minutes given our listeners a lot to think about. You've also highlighted a product, which this is the IntelliFat BOD from Cellmyx. And I want to thank you for doing that, because the reality is more and more people need to know about how you're using it, but also about how other physicians might be able to use the same kit to help their patients in the way in which you're doing it. And I want to thank you for being on Inside Personal Growth, highlighting what it is that you do, highlighting some of the success cases that you've had. The shoulder from the lady in Europe was great. The gentleman playing golf, and I'm sure you've got plenty of others. To wrap anything else up here as we end the show, is there anything you'd like to say to kind of sum things up?
Well, I think in summary, you're if you are interested in pursuing this kind of treatment for your condition, you're going to have to look for it. And then once you find it, research it a little bit. I'd love to say I'm open to, you can consult with me, and that's not what this is all about, but there are others. Maybe Cellmyx might even have a list of providers, who they know in your area. But again, take control of this. You have responsibility for this patient, because the system, again, isn't designed necessarily to optimize your outcome. That there's especially if you're in the insurance world, they're simply designed to minimize their financial risk, period.
Yeah.
And
good points.
You don't want to be a part of that. As far as my own ability and stamina to stay in this game, this is what I'm built for. I started this way as a University of Michigan student and athlete, and then got trained by a phenomenal mentor, John Tu, in Cincinnati, and I see no end in sight. This future is very strong. I plan to be in front of it, staying with it, and really, really thankful to have others in industry, like the guys and gals at Cellmyx, to provide things for me that can make my patients' lives better.
Well, for all the listeners, both physician or the general public who've listened to this podcast up to this point, we appreciate you taking the time. We always appreciate that. We always love putting new things out that are, I'm going to call them bleeding edge, cutting edge, which would be this, and revolutionary. And for more information about Dr. Larson, again, I'm going to repeat it, cdaspine.com. There you can learn more. There's videos, there's educational content, minimally invasive surgery. He has a really beautiful website that really kind of tells what he does and how he approaches this. So, Dr. Larson, thanks so much for being on Inside Personal Growth and sharing your perspectives on where this is all going, treatment of pain, regenerative medicine, and spine surgery. Thanks so much.
Greg, thank you very much, and good luck, everybody. Take care. Thank you.
Thank you.